And let's welcome to the show Dr. David Klein of the Stages of Life Institute. And we want to talk today about fibromyalgia. What is that? I hear an awful lot of people say they've got pain and they explain it away with that.
Well, what happens? Okay, you're going to ache all over, you're going to feel crummy, you can't sleep at night, you're depressed, and the doctor doesn't really know quite what to tell you. You do your own research. Well, guess what? It really isn't research. You Googled it. Congratulations. Okay, don't confuse your Google search with my MD. But the fact of the matter is you came up with a diagnosis of, quote, fibromyalgia, unquote. And you're going to read through it. And there are actually people out there that write a lot about it, including me. And there's going to be a little statement in there that says, of no known cause. Well, every disease in medicine has a known cause. Okay, let's be clear here. You know, we don't really know what causes cancer. I call nonsense on that one. We don't really know what causes the common cold. I call nonsense on that one. What about aspirin? We don't even really know how it works. Yeah, we do know how it works, but we don't know how this extremely common complaint is caused. It's because it's not a disease. It is not a disease, never was a disease, never will be a disease. It is a constellation of symptoms, sometimes known as fibromyalgia. What does this mean? It means your muscles ache all over and you have 18 symmetric spots that hurt. Well, I can give you 100 different causes for this issue, each of which are dissimilar. There could be infectious disease like trichinella, trichinosis. It could be cancer, it could be Addison's disease, it could be fibromyalgia. Now, you know something? Each one of those is different. Could be a magnesium deficiency, very different. It could be a statin causing CoQ10 deficiency. Each one of these will cause, quote-unquote, fibromyalgia. So let's back up a sec. So you think you have a disease, you're going to slap a label on it, if for no other reason so you can become a member of one of these poor me Google sites. Well, good for you. Now that you've gotten past the congratulations that you have a non-disease called a disease. People complain that their doctors don't understand when in fact they really do. They just don't want to hear it because there's no convincing somebody that they don't have this disease because it's a religious phenomenon. It is not a medical one. So you can believe what you want. However, you have this diagnosis. God help you. So what are we going to do to sort our way through it? Well, the single most common cause of fibromyalgia symptoms, which include just basically cramping all over, aching all over, your muscles ache, your arms, your legs, your head ache, is the thyroid. Oddly enough, hypothyroidism causes everybody who suffers from it to develop symptoms of fibromyalgia. So do you have hypothyroidism causing fibromyalgia? About 30% likelihood that you do. You may think, well, they checked my thyroid out. And I'll go, congratulations. The simple testing that they do isn't satisfactory, never was satisfactory. There's something called euthyroid-sick. Okay, if your temperature's low and you have fibromyalgia, you can be pretty well rest assured that you have hypothyroidism. Your temperature should never, underscore bold, never be cooler than 97.6, and that's at 4 a.m. It should get to 99 and change by 10 p.m. If you're going to say, well, when I'm sick, I have a low-grade fever, odds are you have hypothyroidism and somebody missed it. That somebody is probably a long series of doctors that didn't understand what they were looking for. Well, what else can cause fibromyalgia? Adrenal fatigue. Well, we discussed this the other day. Okay, adrenal fatigue, lack of cortisol, lack of DHEA, lack of testosterone, okay, in women in particular, will lead to muscle cramping every which way but loose. Why doesn't it happen as frequently in men? Because their testosterone starts higher. Okay, once you get past that level of 50 to 70 in women, their muscles start to hurt. Okay, so what do you have to do? The answer is replace it. The fibromyalgia is magically treated because you dealt with the underlying issues. So what do we got? We now have thyroid. Hypothyroidism can do it. Hypoadrenalism can do it. Adrenal failure, you can call it what you want, okay? But there are other things. There are nutritional issues that can cause fibromyalgia. Most notably is magnesium deficiency. Magnesium deficiency causes the muscles to go into spasm, and it's almost always worse at night. So here you go. Magnesium deficiency, to a lesser extent potassium deficiency, which, by the way, is actually fairly rare in most people. Okay, magnesium is the most common of all nutrient deficiencies. So you can get it from others as well, but magnesium is the most common. What else can do it? Oddly enough, insulin resistance. So if your insulin level goes up, if you don't know your insulin level, you need to find out, because if it's much over 20, you'll develop fibromyalgia. Why? Because it's inflammatory. The whole body becomes inflamed and aggravated. Insulin is pro-inflammatory. So if you're insulin resistant, you need to control that to get the fibromyalgia under control. What about depression? Well, let's think this one through. Hypothyroidism can cause depression. Hypoadrenalism can cause depression. Magnesium deficiency can cause depression. Lithium deficiency, and there is such a thing, can cause depression. And if you don't sleep through the night because of the depression, you will develop muscle aching all over, which will then and thereby be misdiagnosed as fibromyalgia.
Goodness gracious.
So it's not an uncomplicated deal. What about certain types of neoplasms? Okay, lung cancer in particular will cause your muscles to ache all over. It's rare to see somebody with Eaton-Lambert syndrome. I've only seen 3 or 4 of those in my career, but there are other sorts of perineoplastic syndromes that can present as fibromyalgia. What about trichinosis? Okay, it hasn't gone away. Okay, you can catch this from uncooked pork or bear for that matter. Now that we've had a bear hunt. Did you know that? You can get trichinosis from bear. Possum as well, raccoon. So if you're into eating roadkill, cook it properly. So there are parasitic illnesses that can cause fibromyalgia. So parasitic, perineoplastic, neuroendocrine, vitamin deficiency, psychiatric illnesses. The list will go on and on and on. So you'll watch the TV advertisements, and they'll talk about Lyrica for fibromyalgia. They'll talk about Cymbalta for fibromyalgia. Well, Lyrica is an anticonvulsant. Okay, what does it do? It deepens your plane of sleep. So if you have a sleep disorder, even things like sleep apnea can cause fibromyalgia. Anything that deepens your plane of sleep can start to make you feel better, and that's really how Lyrica works. If you call the company up, Pfizer, and ask them, how does it work for fibromyalgia? They'll go, well, gee, we really don't know. The fact of the matter is it deepens your plane of sleep, and as long as the dosage is sufficient to knock you out, it will work. What about Cymbalta? Cymbalta is an antidepressant. Okay, does it work the peripheral nerves? Really, it doesn't. What it does is it treats the depression, which leads to the fibromyalgia. Are there other things that'll fix it? Certainly. Okay, but first and foremost, you need to figure out why. So what does this involve? It involves properly directed, properly interpreted lab work. You need to make sure that you don't suffer from hypothyroidism, whether it's autoimmune, functional, or otherwise. Okay, there are many ways you can become hypothyroid other than through production. You need to make sure that your gonadotropins, your testosterone, progesterone, estrogen levels are appropriate. Make sure that you're not hyperinsulinemic. Make sure that you're not depressed. If you're depressed, you treat the depression. There are any number of ways you can do this without prescription medications. I personally prefer to use 5-hydroxytryptophan combined with GABA-melatonin and L-theanine. That'll knock you down, fix the depression, and guess what? It seems to help with fibromyalgia also if you're consistent in the way that you take it.
When people start saying they have the symptoms of fibromyalgia, to me, they always go toward the best medicine they can get in their mind, and that's pain medication, whether they have to beg, borrow, or steal it.
Brilliant question. Okay, let's look hard at pain medication for fibromyalgia. Okay, when you're taking an opiate, okay, most people equate pain medications with opiates, and well, they should. Could be codeine, could be oxycodone, hydrocodone, morphine, and so on and so forth. But what do these do to treat this type of pain? Brilliant question. Well, the first thing they do is they make you feel better. What happens as the level of the opiates go up, everything relaxes. Narcotics come from the Greek root of narcos, which is to sleep. Anything that depresses you will make the muscles relax. But then as the level of the opiates decreases, as that level drops, even if it drops from a very high level, the muscles go into spasm, making the fibromyalgia worse. So when people take this type of medication, painkillers of an opiate nature for fibromyalgia, it gets worse. Then they tend to become addicted to it because then they have to continue to take it to maintain that brief period of time where the muscles relax.
And that time gets shorter and shorter in the people I know.
You betcha.
I mean, they're addicted to painkillers.
They have to, and it's tough coming off of them at this point. Are there pain medications that don't suppress or cause this issue? And the answer is yes, but they're very few and far between. So what do I use? I'll use anti-inflammatories. Okay, they'll give you some sense of relief. You can use the muscle relaxants, the anticonvulsants, very beneficial for pain relief with fibromyalgia. You want to steer clear of the opiates. They have got to go away. But you can get by with buprenorphine, which is a mixed agonist-antagonist. It is bad, but it's not as bad as the others. Okay, you can use the tricyclic antidepressants to do this, like Tramadol. Tramadol is a very interesting painkiller for certain types of headache and certain types of fibromyalgia. Why? Because you don't end up with a rebound. So is it a controlled substance? It is now. It never used to be. Okay, why? Because people found that it actually made them feel better. You can't have that.
Boy.
Oh, yeah, if it makes you feel better, then we have to control it a little bit tighter. Well, that's just as well that they did. You got to live life and just accept the fact that our leaders are a bunch of morons.
So see a doctor, get yourself on a path to coming out of this. Don't fall prey to one pain reliever to another, to another, to another. I've seen people go as far as raid somebody else's medicine cabinet and complain of fibromyalgia. I'd like to just take a trip down to the Stages of Life and talk to the doc.
That's right. Give us a call at 407-679-3337. We are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. The office hours are Monday through Thursday, 8 to 5. Our website is stagesoflife.net, and we're also on Facebook at Stages of Life Medical Institute.